Back now on Triad Today, time to talk about health and staying healthy and having regular exams. And gosh, I'd like to have a doctor to talk about that. We just happen to have one in the house. Next to me, Dr. Michael Merz, physician with Northern Family Medicine in Mount Airy, part of the Northern Regional Hospital family. Good to see you, sir.
Thank you. Thanks for having me.
By way of Ohio and Massachusetts.
That's right.
Now you're with us. And how long have you been in practice down here?
So I've been down here in North Carolina for about 7 years now. That includes some residency time in Winston-Salem at Wake Forest, and then practice on my own for the last, I guess, 3 or 4 years now.
Now, and I want to talk about your practice in just a second, but I'm curious, since we've never met before, who or what led you to want to go into a career in healthcare? Was it a teacher, a mom, a dad, or somebody you knew had been a doctor or a nurse, or what was it?
Yeah, so my mom is a nurse. She's a registered nurse. She's been retired for a number of years now, but that was always a big influence on me growing up. If you ask my parents, they'll say I started telling them I wanted to be a doctor when I was 10 years old.
Wow.
So I guess it's been kind of a long...
Yeah, I played doctor in the neighborhood, but I don't want to go
with it.
I don't want to go into that. There's some girls that... Now, so your mom was a big influence on you.
Absolutely.
Angel of Mercy, she.
Yes.
That's pretty cool.
Yep, she worked with babies when she was a nurse.
Isn't that something?
Yes.
All right, now let's talk about regular exams. You know how dentists will sometimes say, well, come in every 6 months.
Absolutely.
Now I'm talking to you as a family physician. How often should somebody get a checkup?
I think the blanket statement is everybody should be seen by their family doctor at least once a year. And that's to make sure you're up to date on routine healthcare screening exams, to make sure that your blood pressure is under control, because that's one of those things that you may not know unless you're having it checked. There are certain people with chronic medical conditions or who are on medicines that may need to see their family medicine provider more than that, but I think nobody should go more than a year without being checked up by that.
Yeah, that's good advice. Now, what about wellness checks? Who should have those and how often?
Yeah, so part of that at least yearly exam is going over things like preventative health, and so that's what we would call wellness checks. So things like cancer screening, routine labs, blood pressure checks. Everybody should have some sort of wellness check. And there are certain things that would lead people to maybe need more done, again, if you have those chronic medical conditions.
How does somebody's family history affect their own health?
Absolutely. So family history is really important because a lot of the things we think about have a genetic component to them, whether it be high blood pressure, high cholesterol, cancer, and a lot of the cancer screenings that we think of, if there's breast cancer or colon cancer that runs in the family, we would start those screenings at a younger age. And so it's really important for everybody to know their family history, talk to your parents and grandparents about what kind of things run in the family.
All right, here we are once again in COVID season, flu season, cold season, different strains of COVID. Who should be thinking about getting a vaccine?
Yeah, vaccines are most important for our at-risk population. So those are people who are over the age of 65 or have chronic immunosuppressing conditions. Those are really important for them to prevent ill effects from any type of virus, or bacteria, whether it's pneumonia, COVID, flu. So those are the most important people. However, I do recommend a flu vaccine for everybody.
Do you say to folks who are at risk or high risk populations that they should also wear a mask?
I think they should wear a mask if they're going to be around people who are known to be sick or in big crowds. Everybody should take precautions. This is even before COVID. Everybody should take precautions to keep themselves healthy. Washing hands frequently, wearing a mask if you know you're going to be around people who have been sick.
Right. I want to put something up on screen here. Northern Family Medicine. Now, correct me if I'm wrong, Doc. I think folks can reach you at 786-4133. Is that right?
That's correct.
Yeah, so if they want to make an appointment or ask questions, or I could have given your home number, but
That's
I didn't
right.
do that. Also, we want you to check out the general website for Northern Regional Hospital. That's choosenorthern.org. Choosenorthern.org, and we hope you will do that. And I really appreciate what you're doing to look after folks in this area, and thanks for everything.
Thank you so much.
Will you come back sometime?
Absolutely.
All right. We'll be right back after this.